Hi, I'm Susan Taylor with Scripps Health in San Diego, California. 1 in 8 men will get prostate cancer at some point during their lifetime. According to the American Cancer Society, roughly 300,000 men are diagnosed with prostate cancer every year. Early detection is key to survival. How do you diagnose and treat prostate cancer? Joining us is Dr. Ramsey, a urologist with the Scripps Clinic Medical Group in La Jolla, California. Doctor, thanks so much for being with us.
Hi, Susan. Thanks for having me.
So let's start with the basics. What is the prostate?
Okay, well, I brought a little model to sort of demonstrate some of that. So the prostate is deep in the male pelvis. So the prostate is here. It sits just below the bladder, which is up here, and just on top of the rectum, which is back here. So the urine starts here in the bladder, and then it passes through the prostate on the way out the penis. And when your doctor is doing those exams to check the prostate, they're feeling through the wall of the rectum on the side of the prostate here.
So how common is prostate cancer?
Unfortunately, it's very common. It's the second most common malignancy after skin cancer.
And what is the death rate?
There are quite a few men that die from prostate cancer. It's about 30,000 men annually, so about 10% of those diagnosed.
But they say there's more than 3.3 million men diagnosed with it in the US. They're living with it, right? The 5-year survival rate is like 99%.
Correct. So prostate cancer is very treatable and manageable, particularly if it's caught in the earlier stages.
So early detection is key.
Absolutely.
Is it genetic? So let's say your dad had it. Does that make you more likely to get it?
So we have seen that there is a family component to it. So men that have a strong family history or certain ethnicities, such as African American men, are at higher risk for developing prostate cancer.
Can women also get prostate cancer? Because I know women don't have a prostate, but they have something that they call the female prostate. It's a particular gland.
Correct. So there are Skene's glands in women, which embryologically have some similarities to the prostate. But women per se cannot get prostate cancer because they don't actually have a prostate gland.
So what are the symptoms of prostate cancer?
Well, in the early stages, there really aren't a lot of symptoms. And this is the reason that we encourage screening, because by the time men have symptoms from prostate cancer, it could be in a very advanced state.
So at what age do you start screening for prostate cancer?
That depends a little bit on men's risk. So in men that have a strong family history of prostate cancer, like a father, a brother, an uncle, or men who are of African American ethnicity, we encourage them to get their first screening at age 40.
And then how often do you get the screening after that?
Yeah, so we usually recommend doing a blood test every 2 years at the minimum for continued screening.
Can a swollen prostate actually cause erectile dysfunction or trouble urinating?
So a swollen prostate can absolutely cause issues with urinary flow because, as we mentioned in the model, the urinary channel runs through the middle of the prostate. So common symptoms are weak stream, hesitancy, getting up a lot at night to urinate. Erectile dysfunction is also very common in men that have enlarged prostate, just as a component of aging and blood flow effects to the penis.
Can you do something to avoid getting prostate cancer?
Unfortunately, not that we've seen. We've done a lot of studies with different supplements, vitamin E, selenium, lycopene, zinc. We've not seen that any of them really protect us from developing prostate cancer. We have seen that men that are overall healthier, in other words, men that are thinner, that are fitter, have a more robust immune system, they do seem to do a bit better. But as far as specific supplements, we haven't found anything that really works.
Does someone know, can they feel if their prostate is swollen?
Sometimes, if they have those symptoms, particularly on the urinary pattern, those are usually signs of a swollen prostate.
So how do you diagnose prostate cancer?
So there's a blood test that we recommend. It's called the PSA. It stands for prostate specific antigen, but it's a blood test that can be measured to help us determine if you may be at a higher risk for prostate cancer.
And let's say the blood test is abnormal, what happens then?
So if someone has a normal PSA, then we do recommend continued periodic screening every 1 to 2 years to have that test repeated. PSA is not a perfect test, but it is an early indicator, and sometimes it will open the door to other tests being recommended.
And what would those tests be?
So nowadays, if people have an elevated PSA, we'll often do an MRI, which is basically fancy pictures of the prostate to try to see if we see any abnormalities within the prostate that may be cancer.
So, how do you treat prostate cancer?
Well, it depends because there are a lot of different varieties of prostate cancer. There are some that are very non-aggressive. We call those low-grade cancers. And often in those men, we'll just observe them. Alternatively, there are some more aggressive prostate cancers, and those men will treat sometimes with surgery, sometimes with radiation, sometimes with a combination of both.
And the surgery now, the technology is incredible, right? The surgery is so minimally invasive.
Yes, that's true. The surgery has evolved quite a bit in the last 10 years, and there are new robotic technologies that allow us to do the surgery through very small incisions. Essentially, what we're doing with the surgery is we're trying to remove the prostate from the bladder here and the urethra. And we can do that now with the small robotic instruments in a much more precision fashion than we used to do when we did it open.
If you remove the prostate, what effect does that have on the body?
The main effects are really two. So the prostate is very integral to the urinary function. So after we remove the prostate, we have to reattach the bladder and the urethra. So that can lead to at least some temporary effects on urinary control. In other words, people may leak some. That's usually temporary, particularly with the robotic approach. The other effect of the prostate, it is involved in sexual function. So nerves that give men erections are very close to the outside of the prostate here. Again, with robotic technology, we've gotten better at preserving those nerves and peeling them off of the sides of the prostate.
After you've had that robotic surgery, how long does the recovery take?
So it typically requires a overnight stay in the hospital and usually 1 week with a catheter. And a catheter is basically a tube that goes into the bladder, and it helps things to heal after we've put the bladder and the urethra back together. We do usually ask that men restrict physical activity for about 4 to 6 weeks, just to let all the little incisions heal.
When should men go see a doctor with regard to symptoms about this?
Well, certainly if men are having any kind of urinary symptoms, so weak flow, pain with urination, blood in the urine, getting up in an excessive amount at night, those things should be addressed with their doctor. And then also general screening for male patients over the age of 45, we recommend with a PSA test.
Any final thoughts, doctor?
Well, I'll just say that unfortunately, prostate cancer is extremely common, and we are seeing a lot of it. But fortunately, it is imminently treatable, particularly if it's found in early stages. So we do encourage men to see their doctor, to discuss it with them, and to consider getting screened.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Sure, it's my pleasure. Thanks for having me.
If you want more information on how to diagnose and treat prostate cancer, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.